Welcome back to the Faculty Factory podcast. It's Kim Skorupski at UTMB, looking at my new friend and colleague, Dr. Stacey Rose. Hi, Stacey.
Hi there. Nice to be with you.
Stacey Rose is an associate professor in the Department of Medicine, Infectious Diseases. She's also an associate professor in the Huffington Department of Education, Innovation, and Technology. And she's the associate director for the Center for Professionalism at Baylor College of Medicine in Houston, Texas, so right up the road from the island.
Absolutely. I don't get to Galveston enough these days.
Well, Faculty Factory friends, Dr. Stacey Rose is here via a friend who's been on the podcast, Geeta Singhal, who recommended not only Dr. Stacey Rose, but Dr. Ellen Friedman. And Dr. Friedman was recently on the podcast talking about Baylor's Center for Professionalism. And Dr. Stacey Rose has a very cool and new topic, strategies for autonomy-supported teaching. Welcome to the podcast, Stacey. Tell us about autonomy-supportive teaching.
Well, thank you again for having me. And I'm just delighted that my name is in the same sentence as Geeta and Ellen because they are truly gems of colleagues and mentors for many years. So thank you for letting me be a part of their crowd. But yeah, I'm very excited to talk to the audience today a little bit about this concept of autonomy supportive teaching. So as you mentioned, I have the wonderful role of being associate director in our Center for Professionalism. And we do a lot of things in the center. We do educational activities, we do remediation activities. And so this initiative sort of was born out of multiple aims within our center. And the goal of this faculty development for autonomy supportive teaching is to help faculty create better learning environments for trainees and frankly for themselves. And that is under the bigger sort of umbrella of professionalism in our view, because when you can foster a supportive learning environment, everybody benefits from that. The educators have more engagement and less burnout. The trainees certainly have more engagement and less burnout. The other way that this topic is connected to the center, and I feel like it's important to mention this because, so much of academic medicine is collaborating and building on each other's work. And so I really want to give due credit to Dr. Greg Goldner, who is in the HCA system, but he was an invited guest of ours. We had heard him speak actually at a symposium on professionalism that was held at Mayo Clinic some years back. And then we invited him to speak at Baylor last year as part of our Profiles in Professionalism series. And this was just one of the topics that he touched on, that he has done a lot of work in connecting self-determination theory to medical education and well-being in medical education. And so we developed a faculty development workshop, really building from many of the tools that he mentioned. So I just wanted to give due credit where credit is due, and we continue to be in touch with Greg and collaborating with him. So it's a win-win.
Yeah. And we've done self-determination theory. In fact, Dr. Jeff Linus on the Faculty Factory podcast. Go to the website, facultyfactory.org, and look it up and go to the YouTube channel and you see all the buckets of topics. And you're right. I love self-determination theory. So good props to Dr. Greg Goldner.
Great. Yes. And it sounds like to Dr. Linus as well. And Adam Newfield has been in this space. So there's a lot of interest in this and for good reason. So the way that we have rolled this out at Baylor College of Medicine is that we have sort of a road show, so to speak, of a workshop that we are offering to a variety, to all the departments at Baylor that are interested. We've been, I think, successful in part because we've been able to customize the workshop based on the group. So this is definitely something, if folks wanted to implement something similar at their institution, I would absolutely advocate for having sort of a faculty champion in the department where you're offering this faculty development. Frankly, that's probably just a good tip in general for faculty development, because whenever people can see that the topic is really relevant to their practice and their teaching practices, then I think they're much more interested in taking the suggestions and incorporating them into their teaching practices. So What we do in this workshop is we present sort of a mini didactic on self-determination theory and how it applies and what we mean by this concept of autonomy supportive teaching. So actually, let me just do that for a moment here for your listeners, kind of connecting the dots. So self-determination theory, it sounds like, as you've already had described on a different podcast, is a psychological theory that came out in really the 1940s. Dr. Deasy was really instrumental, and it has more recently been applied to medical education. But the really fundamental principle is that all human beings need three things to be happy and motivated. They need autonomy, they need relatedness, and we're going to call it belonging because ABCs is easier than ARCs, but autonomy, belonging, or relatedness, and then a sense of competence. So those ABCs, autonomy, belonging, and competence, are really what all human beings need to feel motivated and to have well-being. So that has been tied more recently to medical education. And the idea of autonomy supportive teaching is that if you can teach, educate, provide a clinical learning environment, whatever is the space you're in, that is supportive of autonomy and belonging and competence. But people say that autonomy is really the anchor across those three domains. So if you can engage in strategies and practices that promote those pillars in your learners, then everybody wins. And alternatively, if you're not engaging in autonomy supportive teaching strategies, you may be running the risk of actually thwarting them. And that is, again, not good for anybody.
What is the opposite of that? What is having a non-autonomous?
Yeah.
Is that a word? Disinton? I'm not.
Yeah, thwarting. I mean, when you engage in behaviors that thwart someone, that is the word that is typically used. That really inhibits someone to achieve a sense of autonomy, belonging, and competence. So, what are examples of that?
Yeah.
So, when you are working with a learner and they have a recommendation for a clinical management plan, let's say, and you disagree with that management plan, if you immediately say, no, that's wrong, we're not going to use that antibiotic, we're going to use this one, you're really taking away the opportunity for that learner to come away from that interaction feeling like they played a role in the development of the management plan. What I also want to just get out ahead of in terms of like a myth busters for autonomy supportive teaching, I don't want to imply that educators who are trying to practice autonomy supportive teaching are not allowed to disagree with the trainee or are not allowed to redirect the trainee. It's about how you do it.
I was going to say,
So
because what if that antibiotic is incorrect?
no, absolutely. And that's really what this workshop is all about, is we have this mini didactic and then we go through cases of situations where you might be in a situation where it might be tempting to just tell a trainee what to do. And so how can we learn to phrase things in a way that allows the learner to do the learning and get there so that they feel that they have agency in the decision making that goes on for the patient, while of course maintaining patient safety and well-being. So we're looking for an all win here. And
And Stacey, this is so brilliant because it applies to not only the teaching learning environment, but the work environment.
oh goodness, yes.
If you have staff, don't you want your staff, don't you want your teams to feel autonomous, belonging, and a sense of competence versus telling them, this is what you're going to do, this is how you're going to do it. And then people feel disengaged and they're like automatons, they're robots,
Right.
they're replaceable because they have no sense of, as you said, personal agency to maybe think creatively. So I love this concept of autonomy supportive teaching because the principles can be applied in leadership, in
I was just going to use the big L, and I know that's your area and your background as well. And I think it absolutely applies. And one of the things that the center, so we do consultations for challenging professional situations in addition to individual remediation. If someone's experiencing something and they come to us to say, hey, how do I handle this? Many times our consults are related to psychological safety. So environments where maybe that is threatened. And again, that concept of psychological safety is very related to these ABCs. If you as a leader are trying to create a situation where, a staff member, a learner, a faculty, anyone is going to feel comfortable raising a concern or contributing ideas that are going to make the situation better and make for a more, an optimal final product, then we really do have to be encouraging these qualities in all of our, all the members of the team. So you're right. I think it's very broadly applicable.
So what are some of the strategies, like the take homes?
Yeah.
If I'm an educator, how do I create this autonomy supportive teaching environment?
Yeah, so I think it can be very specific and practical, and that's really the goals of our workshop too. So let me see if I can distill it down. So first, let's just take the autonomy piece. So again, I want to just point out autonomy does not always mean that the learner gets to decide every decision, right? Or that they're doing things on their own. I think sometimes we think of autonomy more in the competency-based education, and we say, see one, do one, teach one, or to what degree of supervision does someone need before they can engage in autonomous practice? That's not the kind of autonomy we're talking about. We're talking about where the learner actually feels like they have agency, that the decisions that are being made are in alignment with their values. So, how does one put this into practice? Let's go back to that antibiotic scenario. Let's say that someone is recommending an antibiotic that, in your view, as the experienced attending, could cause more harm because of, let's say, the kidney function of the patient. Then if you were not interested in autonomy supportive teaching, you could simply give the answer. You could go straight to the answer and say, well, I don't think that's the best idea here. I think we should give such and such. But again, then you're taking away the opportunity for the learner to find out the quote right answer for themselves and feel that they're a part of the decision making. So what you could do is ask questions. Can you tell me a little bit more about why you chose that antibiotic?
Right.
And then you can sort of nudge them. Literally, the term in the papers is nudging. You can nudge them to the right answers. Well, it sounds like you wanted to choose that antibiotic because it would cover the organism. Well, that's great. What are some other considerations that should be going through your mind when you're selecting an antibiotic for a patient, right? So you're nudging them. You're encouraging them to say, well, I guess I have to also think about what other medications the patient is on. I need to think about what their kidney function and their liver function is. Got it. Okay. So I'm so glad you said renal function, right? Like and the other thing, and again, I'm stealing from Greg here, but I love it. When the trainee does get to what you think is the right answer, you have to call their attention to it. Kind of like how I'm sure you've had podcasts on feedback. We all know how critical feedback is to the learning paradigm. And we often say with feedback, you have to make it abundantly clear that I am giving you feedback now. This is feedback. We're engaging in feedback. The same is true with autonomy. You have to show them that they got the answer. So when they get to the point of saying, well, now that I've thought about it, I think it would be more appropriate to give this drug. You say, okay, you want to give, well, vancomycin, an ID doctor would almost never say that that's like the best answer. So let's say you want to give cefazolin. Great, let's do that. And again, you're showing them you want to give cefazolin. Great, let's do that. It was your choice, and we're going with your choice. But you've nudged them sort of in the direction of the correct answer. I want to also point out there might be situations where the trainee, for whatever reason, is not able to be nudged in the direction that you think is important for patient safety or best care. Once again, we are not suggesting that you just defer to the trainee's plan, right?
No.
That's not necessary. But what you can do in that situation is at least explain the rationale and connect that rationale to the trainee's values. So if the trainee never got to the point of selecting a new antibiotic, you still could say, what would you think about giving cefazolin in this scenario? The reason that I think that would be a superior choice is because it would have a better risk profile for this particular patient and their kidney function. What do you think about that? I know we both really want to support this patient and make sure that they're not going to have any organ dysfunction. It just lands a little differently, that you're working on it as a team, and you're making sure that the plan aligns with their goals. It's just very different than what we are often tempted to do because of time constraints, of just say, no, let's give cefazolin, right? Because then you're just taking away the ability of that person to feel engaged.
For sure.
I want to point out, if I may, I want to kind of move on to the belonging, because this is another issue where I think there's an opportunity for some myth busting when it comes to how you create or how you thwart a sense of belonging in our learning environments or in our team settings, et cetera, in our meetings, whatever is the situation you're applying the strategy to. So I think we all kind of have a general sense of what we mean when we say belonging or relatedness. People want to feel like they belong. They want to feel like they're a part of the team, that you want them there, that you care about them, that you value their membership on the team. The learners want to feel this. Frankly, the faculty want to feel this, and the staff as well, all humans. So when you are in a learning environment, you can help support a learner's sense of belonging in multiple ways. And it doesn't all have to be sort of touchy-feely, right? Some of it can be personal, getting to know them. What are their interests? What are they trying to get out of the rotation? Something personal about them, getting to know their name, right? We have had situations where a student goes through an entire rotation and they feel like the whole time they're being referred to as the student, right? So you do get to know their names. That's sort of a personal sense of belonging. But there are other things that we can do to create a sense of belonging. One is informational. So I know it sounds sort of strange, but when you are able to tell a trainee, you need to, I'm asking that you come to the rotation at 7 a.m. on Thursday, and here's the room that we'll be asking you to meet. And here are the contact information for all the people that you'll need to know on the team. It's like informational support or logistical support that creates a sense of belonging in the trainee. Your interaction with people other than the trainee can be really instrumental in creating or thwarting a sense of belonging. So the idea here is you're trying to maintain a civil, professional environment at all costs. If you start to badmouth another service in the closed doors of your team room, even though that is not like directed to the trainee, it's what we call covert incivility, or a covert thwarting of belonging, because then that trainee may be sitting there thinking, gosh, what are they saying about me when I'm out of the room? So those are some things to think about when you're trying to create a sense of belonging, and certainly do everything in your power not to thwart someone's sense of belonging. And of course, some of the more obvious things go without saying, right? Trying to use supportive language, inclusive language. Some might even suggest that you clarify your intentions at the beginning of a learning experience, or at the beginning of a meeting series if you're using it, as a leader, and really clarifying to people, hey, it's my intention that everybody in this room feels empowered to speak up when they disagree, or to let me know if they feel uncomfortable, whether you do that during the meeting, after the meeting. It's really my intention that everybody has a voice at the table. You can say those words and mean them. Of course, you have to mean them. You have to follow through. But those are some other tips for creating a sense of belonging.
Oh, Stacey, that is great. I like that you said say those words and mean them, because we've all been at meetings or places where people say, I've got an open door policy, come by anytime, or my email's public, email me anytime. And then you've done that and people are like, what are you doing? You just showed up? Or what do you mean you emailed that
Right.
person? Are you nuts? So following up and not only saying the words, but demonstrating that you want to hear everyone's voice by inviting it.
Right.
Dr. Rose, would you like to share something, or what are you thinking about? Kim, you look like you're noodling something around there. What are you thinking? Or, Joe, haven't heard from you. Do you want to kind of chime in here? I know you got something to say. That invitation, and who wants to disagree? What do we have? How it has
Yeah.
to be thought of? Let's not be groupthink here. What else haven't we considered? Inviting that space and making sure that that becomes part of the routine creates that culture. And you
Yeah.
said something else super important, Stacey. Let me try to remember it. Oh, it was about the whole covert incivility thing. Super interesting to me when you were talking about how when we want to create belonging and relatedness, it might be almost instinctive or natural for us to kind of like go like when you're playing a sport, it's like the bad team, we're the good guys or the bad guys.
Right.
So all for one for all, it's us against them. So one way that we might, and it's natural to think of like, we're the team, and we're better than that team, and it's a kind of a healthy competition. But sometimes it's really you giving me something to think about in a misguided effort or way to unite all of us. It's us versus them by creating an enemy internal in the institution, but that might kind of provoke some of the, yeah, we're better than that team or that unit or that shift. It does kind of sound ooh-rah and like, yay, we're number one. And as you brightly pointed out, Stacey, I like how that ooh, that subtle, nuanced kind of feeling of,
Mm.
is this, but we're all together though, but we're all one
Right.
institution, we're all one company, we're all one whatever. So I think there's a real subtlety there about, and I'm gonna think a lot more about this. So thanks for drawing our attention to sometimes thinking through things carefully when we want to invoke some common threat or common enemy, thinking, well, it's because we're building teams, but the jokes or the kind of innuendo or slams might not be going the way we intend them to be, especially like long term. So thank you for calling me out,
Absolutely.
Dr. Rose.
And actually, on that note, I have to mention there's an article that I often reference called "Crystal Clear or Tin Ear: How do Medical Students Interpret Derogatory Comments About Patients and Other Professionals?" This was published in Medical Education Online in 2016, and I know I've referenced it several times myself because I just think it's fascinating qualitative interviews of these trainees. This article had looked at clerkship students and did qualitative interviews with them. And one of their findings was that students, when they were in the room when the faculty member was disparaging another team, they actually described saying how it made them feel more like they were a part of the in club. And that was very eye-opening because that is exactly the opposite of the type of cultures we want to be breeding as medical educators. I mean, at the end of the day, we are on one team, right? It's like Team Kimberly when she's in the hospital. It's Team Stacey when she's in the hospital, right? And so we have to find ways to hear each other's perspectives and value them. And one way to do that is to demonstrate that sense of we are all part of the same team, even if I don't understand where this other person is coming from. They, I should absolutely mention the workshop that we're doing, this autonomy supportive teaching workshop through the Center for Professionalism, has been a co-creation with two other faculty members at Baylor, Dr. Sarah Keyes and Dr. Allison Robbins. And Dr. Robbins does infectious disease. Dr. Keyes is in the School of Health Professions and has some background also in SDL, self-determination theory. The reason I'm mentioning them, even though I should have mentioned them from the beginning, so shame on me. I love these two individuals. We've been having so much fun developing and implementing this roadshow. But Allison always quotes a faculty member who, when she was growing up, taught her this beautiful phrase of "help me understand."
Mm.
In other words, when you were having a situation, you're the ID consult team and someone else is not taking your recommendations, or maybe you're frustrated by someone else's recommendations because maybe you don't understand them, that faculty member taught her to say, "Help me understand," because it sounds much different than "Why didn't you take our recommendations?" or whatever it is. So again, you are always sort of on stage as a faculty member, whether you realize that or not. You're role modeling all the time. And so if you can incorporate behaviors that are supporting a sense of belonging across the team, across the interdisciplinary team, then your trainees, your learning environment is going to echo that sense of belonging. And it just makes everyone feel more engaged.
For
So I would be remiss if I didn't get to squeeze in some strategies that pertain to the competence, the C.
yes.
And Dr. Goldner would say it's competence plus meaning. And I think these themes are very connected. The idea is that a learner, and really again, anyone, needs to feel like they have the skills to meaningfully impact the other person, party, patient, you fill in the blank. They want to know that their actions have impact and that they are capable of them. They want to have that feeling of competence and that their actions have a meaningful impact. So, as an educator, some things that you can do to call attention to that are to both give someone feedback that is appropriate for their level of training and help them see where they are on the training journey. And I'll give you sort of an example in just a moment, but also to connect their actions with meaning. So let's imagine a scenario where a trainee is actually, we just had this example because our child adolescent psychiatry department signed up for one of our workshops. We worked with their faculty champion and crafted some cases. So one of the cases that we gave in that seminar was about a situation where a new fellow goes to see a child with autism spectrum disorder. who has been having a problem acting out at school. That's the reason that the parents are bringing this child in. And so the fellow is seeing the patient and then comes and discusses the case with the faculty member. But it turns out in the discussion that it seems like the fellow only got history from the parents and did not engage the child in the actual history taking. And so this faculty member is now in a position of needing to give feedback to the trainee, some constructive feedback. So how do you do that in a way that promotes a sense of competence, right? Because again, constructive feedback can still help competence. It's sort of a myth that you can't give someone constructive feedback in a way that will land positively. So in this case, the suggestions that were discussed were along the lines of putting it in the context of where they were in their training. Maybe they're a first-year fellow. Maybe their whole psychiatry training was with adults and now they're on child adolescent psychiatry. Maybe they've never worked with children with neurodivergence and they're feeling uncomfortable and they need some guidance in how do I engage the child directly. So you can sort of, again, ask questions. Questions are your biggest tool in the toolbox. Can you tell me more about how you got this information? And what do you think would be useful or not useful about getting additional perspectives for this child's case? And kind of, again, nudging, but in this way, in competency, getting them to sort of see. And then you can say things like, I wouldn't expect you to have that skill given the stage of training that you're in, but that's something that I'm here to help you with. And we can circle back to it in 6 months and sort of see how you're doing on that skill.
Wow.
The other thing you
To
can
grow
do is,
confidence.
yes,
Confidence. They
exactly.
don't feel like, oh, I should know that. No, I wouldn't expect you to. I like that.
Right, right. And then on the meaning front, it's connecting it with meaning. So, hey, by engaging in this case, let's say the thing that they did right was that they did engage the parents because you need both. So you can give them feedback and connect that to the meaning of the interaction and say, I noticed that you developed a really healthy, trusting relationship with the parents, like developed rapport very quickly. And I just want you to know that that has value because now these parents are going to be more likely to share important information with you so that you can better take care of the patient. Thanks for doing that. It's subtle, it's small, but when you can help people see that their actions have meaning, they're much more likely to repeat them. We have another example we talk about where like often this happens where a patient is being discharged from the hospital and rarely do our busy trainees remember to send a note to the primary care provider to let them know what happened, right? So if you see that happening, let's say the fellow does that and they CC you, that's a great opportunity for you to circle back and say, hey, I noticed that you looped in Dr. Rose, who sees this patient on the outside. And I just want you to know that when you do that, you're actually reducing the chances that this patient's going to be rehospitalized in the next month. Like it's subtle, it's small, but that trainee, again, is going to be much more likely to engage in that behavior in the future because they can feel the meaning that it has on their greater mission. So I know I've talked a lot. I realize maybe that's the goal of this podcast, but I feel like I've talked a lot. I want to give you an opportunity to sort of ask questions and allow this to be back and forth.
No, this is brilliant. There's so much richness in here, and I think as we said earlier, the application can be really broad. And all this, to me, the thread through this is it takes time. And I can hear some people going, "Oh, but this takes time for me to learn my trainees or the colleagues and students and learn their values and share information with them. That sounds all great, but I don't have time, Dr. Stacey Rose." And then I mean, what would you say in response to someone saying, "Who's got time to do all this?"
Well, I think I would ask a question, which is to
I'm
say,
curious.
I would say, I want you to think back to an educator that had a profound impact on you.
Mhm. Mhm.
Who helped you along your journey? And odds are it was someone that took the time to understand where you were along your professional journey, that was interested in what you were interested in, that took took an interest in you and was able to provide you with either feedback or tools or suggestions that got you to where you are today. And so in some ways, is it an investment of time? Sure. Is it something that is going to feed forward and that the next generation is going to remember when they're being interviewed by for their medical education podcast? They're going to say, oh my gosh, absolutely, that person was so instrumental for me. And I also want to just say selfishly, I mean, the faculty are burned out too. I mean, we get it. Everybody is struggling. It's a stressful field that we have engaged in and getting more stressful all the time. So I would actually say you don't have time not to do
Got
this,
to.
because you need to be able to go home at the end of the day and know that you have created a situation where the the person that's going to be taking care of you when you are in the hospital is armed with a sense of autonomy and belonging and competence, and they're motivated, and you are going to feel more engaged. I know I personally, I have I have different clinics, and I will just shamelessly say that there are some mornings when I look at my schedule and there's so many patients scheduled, and I look and I see that I have a trainee, and my mind instantly goes to, okay, that's going to take me extra time. And inevitably, without fail, I walk out of that clinic feeling uplifted, not more tired. And the reason is you want to engage. There's a reason why we chose academics. And so that is a back and forth. As soon as you lean into these concepts of creating a space where learners can ask questions, creating a space where they can be the ones looking things up and coming to you with suggestions, showing them that when they connect with a patient, that has meaning, I guarantee you that comes back to you 1,000-fold.
Dr. Stacey Rose, I wish you were a little bit more enthusiastic about this topic. Coming through, I just feel like I want to, yes, we are Sparta. It's like you should be giving all the motivational talks everywhere. That is, amen, sister. It's wonderful. Thank you so much for being on the podcast, Dr. Stacey Rose. And
Thank
if you
you
want to be in the
again. So much
podcast,
fun.
yeah, and share your wisdom. If you want to be in the podcast and share your wisdom or your stories, go to facultyfactory.org, email me, check it out. But thank you so much, Dr. Stacey Rose. Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.